Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Aultman Health System, Studio Arts and Glass, and Genuine Appraisals and Liquidations. Today, Brad and I are broadcasting from our administrative offices, and our special guest is Shannon, Urena, certified physician assistant with Aultman Medical Group, Plastic Surgery. Good morning, Shannon, and welcome to the show again.
Thank you so much for having me.
Have you ever wondered about the term plastic surgery? The term plastic surgery comes from the Greek language and literally means reshaping or remodeling from the original flesh. Plastic surgery is a surgical specialty involving the restoration, reconstruction, or alteration of the human body. It can be divided into two main categories: reconstructive surgery and cosmetic surgery. Today we welcome Shannon Urena from Aultman Medical Group Plastic Surgery, and we will be discussing the different types of plastic surgery. We'd like to remind our listeners that today's program is also available on our podcast. Just look for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe.
So Shannon, welcome back to the show. We're happy to have you today. Please tell your listeners a little bit about yourself and your background.
Thank you so much. I'm so excited to be here. A little bit about myself is that I was born and raised on the East Coast in New Jersey. I also trained on the East Coast for some time at Rutgers University.
And how did you get here?
So my husband is a resident. He's training at Aultman Hospital and so that being said, we ended up gravitating towards this area, but we love it so far. It's a great place to be. Compared to East Coast is very fast paced.
Yeah.
Lots of traffic. It's very city-like.
I've been to New Jersey. It was a nightmare on the highway. Okay. And that was a long time ago. I can't even imagine what it was like now. So. Okay.
Yeah. Oh, it's just getting worse. I'll confirm that.
Okay. All right. So your training was in New Jersey or here or both?
So mainly on the East Coast, in terms of my clinical experience and being in the hospital systems, mainly East Coast area. I did do another master's program in the Pittsburgh area at Chatham University. So, starting to gravitate towards Pennsylvania area. I did have experience at UPMC hospital system as well. So kind of like that.
So what about plastic surgery? How did you gravitate towards that?
Great question. I think having had exposure when you're a student, you get some of your general surgery, you get some of your internal medicine, your basic sciences, basic medical experiences on the floor. But I gravitated towards surgery, and it's very unique in that plastics is not just medicine, it's also an art. I think, the caveat is body contouring, molding. It's also very versatile in the sense that, in one sense, I could be seeing many patients for skin cancers in a day, and then another day I could be doing a mix of breast cancer patients and, cosmetic consults. So you're never bored.
Jeez.
It's challenging, but in a good way.
So what is your role as a certified physician assistant in plastic surgery? And plastic surgery is an old name, isn't it? Don't we call it something different, or is it still plastic surgery?
It's still plastic surgery. What have you heard it called?
Well, I don't know. I guess just other things, maybe slang terms. I don't know
Mhm.
over the years, but you know, when I think of plastic, I think of plastic. You know, why do we call it plastic? You know,
Right. Great question. So it comes from the old Greek word plastikos, which means to form or to mold.
okay,
And
all
so
right,
that's where it came from originally.
okay, interesting. All right.
Mhm, mhm. So did you want me to elaborate a little bit on the role of being a PA in plastic surgery?
Yeah, we'd like to know what you do.
Sure, sure. So there's an office side of the practice, and then there's the OR side of the practice. Mainly in the office, both my colleague and I, Dr. Lopez, we are evaluating patients. So he has his own set of patients. I have my own set of patients. Again, we do see a lot of skin cancers. We see a lot of benign lesions as well, pre-cancers that we evaluate for. A lot of times they've already had their skin biopsies, and we then decide how are we going to excise them, and whether or not that can be done here in the office or if it needs to go to the operating room. Transitioning from skin cancer, we also do a lot of breast reductions. Women who really do need a breast reduction, and they suffer from upper back pain or lower back pain. They've been trying to lose the weight, but because of the weight of the breast, they can't actually get around as easily. So it is a life-changing operation for them. We also do a lot of women or men who have lost a lot of weight over time, and they have a pannus, kind of like an apron by their abdomen, and they're left with this excess skin, and they can't mobilize around. And so what we do is we evaluate and we discuss removing that excess skin and what would be the best option for them. And again, life-changing, because then they're able to continue to move around. So, kind of
What's the most weight you've ever taken off of somebody's abdomen?
that, yeah, I would say around close to 20 pounds.
Wow, gosh, that's amazing. And then you tighten up the skin surgically, or what do you do?
Yes. So essentially, we take that piece off that's hanging, and then we pull it down, and then we close the skin. Now, sometimes as a part of that procedure, there is something called a diastasis recti repair, which are the muscles, your abs, in other words, that have stretched with the skin that has also and so we repair that muscle and underneath, and then we bring down the skin, because it'll still be bulging, and that's obviously not ideal.
Never thought of that. Interesting. Is it painful?
Yes. So of course, I think any surgery that you go through, especially a major surgery, especially if you're going to be in OR for a minimum of 3 to 5 hours, right? Just depending on the extent of it. Yeah, you would expect pain, but we pride ourselves on being able to manage that pain post-operatively. And most patients are able to wean off within a couple of days or a week, or they just take a Tylenol extra strength, and that's it.
And you are listening to Health Matters with the. Okay. Welcome back to Health Matters with the Medicine Center Pharmacy. Did you know we offer free prescription delivery? Call your Medicine Center Pharmacy and learn about our prescription delivery program.
All right. Well, let's talk about what type of procedures you perform at your practice.
touching base on procedures, there are office-based and there are also OR-based procedures that I perform. Some office procedures in terms of medical are the benign skin tags, shave biopsies for skin cancers or neoplasms that we are unsure of that we need to biopsy. Also actual excisions. So I do or perform almost all of our skin cancer excisions here in the office with closure. And from a cosmetic standpoint, we have patients that also want to be evaluated for keloids that are benign, that have happened because of trauma, or cysts that may be on their face and they want removed because it's not as aesthetically pleasing to the eye, or they're young. So I also remove those. Kind of segueing a little bit more into cosmetic realm, we do a lot of Botox, we have fillers, we have chemical peels, we have microneedling, all of that fun stuff.
Gosh, amazing.
So that's very dynamic.
And again, out of office in the operating room, Dr. Lopez and myself work in tandem together. So again, we do a lot of the excisions that can't be done in the office and need extra skin coverage. So if we can't just close it primarily in a nice straight line, they may need a graft. So we're again actively working in tandem because a lot of these patients don't just have one skin cancer. They've been exposed to sun for a very long time. They have 2, 3 skin cancers they need removed, and to make it efficient, we're both working at the same time.
Where do you get the skin for the graft?
So it depends the location of the actual skin cancer. So if it's closer to the face, we may decide to do a full thickness skin graft from behind your ear so that it's hidden.
Oh my gosh, okay.
We may take a skin graft from your clavicle area, depending if it's closer to upper extremity. Again, there's another product that we use. It's called Integra, which has been absolutely amazing. It's a bilayer, it's off the shelf, and it essentially uses your own nutrients to form your own skin over time. It does take a little bit longer, but it is pretty amazing in terms of what it can do in terms of skin coverage.
So this is not a skin like substance, or is it Integra, or is it just a medicine or a drug?
Integra is essentially like a bovine graft, and it's a gel, and that bovine gel graft is placed onto and harvested onto where the excision or skin cancer was removed. And so it's placed on there for about a week to 2, depending if it's been incorporated after that time. And then we remove a little silicone layer from it. It's a bilayer, so it has 2 pieces to it. And essentially your skin will eventually heal and grow from the inside out.
Very interesting. Oh, gosh.
So how does your role with your colleague, Dr. Lopez, differ between the office and the operating room?
Okay, great question. I think that a lot of things are similar, but also different in the sense that, of course, he will likely, he has more advanced training, so he will be the one to evaluate perhaps a blepharoplasty or like a facelift. I feel that a patient may not benefit from filler alone or Botox because there's only so much you can do with injectables, and they have significant aging, and I really don't think they should place their money towards something that they think will benefit them. And I'll refer them over to Dr. Lopez because, of course, that's more advanced and more invasive. Dr. Lopez also does a lot of our evaluations for our breast reconstructive patients. Again, it's very advanced because not only is it just plastics, we also need breast surgery on board. And we work a lot with another surgeon called Dr. Shalad. And it's very important that their thought process is aligned because I'm not always in the operating room. Half of my time is in operating room, but mainly he's there more often, and it's important for him to do the breast reconstructive evaluations. And so anything that's complicated or more advanced that needs a lot of attention or complications, those are the kinds of things that he will evaluate.
I just have to ask this question, okay?
Sure.
Every once in a while, okay, there is a person that has had facial reconstruction, okay?
Mhm.
And I can't think of the name of the movie star recently that just doesn't even look like themselves. And once in a while, there's just a grave error. What's the deal? Is everybody's skin different, or why would this happen? Poor technique or what?
So there's multiple facets to that question. One is that, some people are not going to the proper facilities, or they're not being injected by somebody who's been trained in this field for a long time, who has known the industry, and a long time ago, probably 15 plus years ago, before we had the filler that we have today, which is the hyaluronic acid, which our bodies produce. We make it in our eyes, we make it in our bones. So it's a little bit more susceptible to our facial anatomy. It eventually will dissolve over time. That being said, before that time, patients were using something more permanent, like a silicone filler, and they don't dissolve. And it really makes you almost look very cat-like. And so these are, one, unregulated industry, not going to the proper injector, not knowing who you're going to, having had fillers that are permanent, and not knowing, and you should know, and you should ask questions because this is your face. And just knowing when to stop, and that comes with a relationship that you develop with your injector, and that injector needs to understand, there's at this point, I think is there something else going on, right, that we need to address? And there are difficult conversations to have, but I think it's multifaceted.
Well, since the face is visible, okay, that I think that is that the most difficult plastic surgery, okay, compared to like a breast, which is covered, or the neck or the belly or whatever, which is normally covered. So, yeah, yes, no.
Well, there's a lot of complications that can happen anywhere on the body. You have to be careful even when you're liposuctioning. That's in the abdomen. There have been cases where, trainers or people have punctured organs, and you still have to be careful in the area. Face, yes, I think in the sense it is higher priority because that's something that somebody sees every day. and there's a lot of vasculature in the face. So you can really deform somebody if you don't know your anatomy from a surgical standpoint, even if they're getting a facelift, even a blepharoplasty. Blepharoplasty, not so much, because it's just excess skin that you're removing, not necessarily going into deep musculature or anything like that, but certainly facelift. And, patients pay a lot of money to have things done to their face. So I think it's important to keep that in mind.
Very interesting. Why don't we just take a break right now, Brad? It is the bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy. Okay, you're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Shannon Urena, certified physician assistant at Aultman Medical Group, plastic surgery. We have a lot more to cover this morning, so let's get back to the show.
All right. Earlier in the program, you were discussing the very diverse amount of procedures that you perform at your practice. And you mentioned something about invasive and non-invasive plastic surgery. I wondered if you could define that for our listeners and then talk about any non-invasive plastic surgeries that you perform at your practice.
Great. I think simply put, invasive procedures would require perhaps general anesthesia and going to the operating room, whereas non-invasive procedures would be something that can be easily performed in the office under local, or not even under local. Some examples of that non-invasive would be something like an injectable, Botox, filler, chemical peel, or even microneedling, or any kind of cosmetic lesion that can be done under local, like removal of a keloid or removal of a scar, and so forth. Operating room, of course, a lot we've already touched base on, which is our paniculectomies, our abdominoplasties, our breast reconstructions, facelifts, things like that.
So can you make me look like I'm 39 again?
Sure.
I'm actually double that.
Well, it's funny you mentioned that, because a lot of people say, well, make me look like I was 20 again. And actually I think patients would look very strange if we made them look that way.
Yeah, sure.
We want patients to age gracefully, and say, oh, look, you look like you've had, you look refreshed, or you look like brand new, or something like along those lines, rather than, ooh, what did you do? Because that's when we run into trouble, is that we have this skewed perception. We need to, in our 60s or 70s, we need to look like we were in our 20s, and actually that's not what we should be going for. We can shave maybe a decade off and you'll still look really great, rather than taking off, years.
So, I've got a question for you about fillers, and based on some previous comments you've made, it isn't as simple as just injecting someone in their face or whatnot, from what I gather. So can you comment on maybe the risks versus rewards of non-trained plastic surgeons doing plastic surgery procedures like Botox or other fillers?
I think the industry is somewhat obviously unregulated, and so a lot of people can just pop up shop down the road and claim themselves that they do plastics, or they do injectables, or they have medi spas. And so because it's unregulated, you don't always have a medical professional injecting you. And I think we shouldn't be so naive about, the fancy flashing lights, and because a lot of these companies can make it look really great, and they have the best websites, and you really have to look up credentials and know, okay, who am I seeing for this? And so, the risk involved with that is because if they're not licensed or they haven't had a lot of training in this, you can inject in a vessel in the face, because again, you have a lot of vasculature in the face, and you can cause a clot. And what happens with that is, okay, you clot off the artery vessel, and you can cause necrosis to the face. You can have somebody's lip necrose. You can have somebody's cheek or nasal labial line, kind of from the nasal facial region all the way down to kind of their jowl area, die off. And if they're unable to recognize that that's happening while they're injecting, patients have gone home. Patients have been injected, they've gone home, and they have this dusky skin, and it's turning purple, and they can't decipher, they don't know, they're not educated from the injector to say, hey, look for these things can happen. And then we run into a problem. Recognizing that early on is very important. And it's very sad, actually, to see that. So I think we should be more just knowing where you're going, who you're going to.
Okay. As far as discounts in the Alley program, how does that work?
So Alley is a app that we use, supplied by our Allergan, our big company that we get our supply from. So Allergan supplies our Botox, our fillers, our chemical peels. And so they have created this app called Alley. It used to be called something else, called Brilliant Distinctions, a couple years ago. And now anybody can download the app for free. And any of our patients, they'll create an account, and for every Botox or any filler, microneedling, chemical peel, they can earn points on their account, and we validate those points that convert into a money system. So, they can then get money taken off when they come back in the future for more Botox or filler, or things like that.
How about we explain what Botox is used for?
So Botox is used for the upper 1/3 of the face. It's FDA approved for the upper 1/3. So essentially your forehead, your crow's feet, kind of where you squint.
Oh, so that's how I can get to look like the 39 again, huh? You pull them eyes beside and pull the head up or something, or
it's so great that you said that, because patients think it actually pulls your face back. Whereas, so it's a neuromodulator. I don't love using the word toxin. Yes, it's Botox, but it's a neuromodulator because it's acting at that synapse, right, where your muscle structures are, right? It relaxes the muscle. It won't tighten the muscle, right? So patients come in, they're like, tighten my face. And I say, we can't tighten the face that way.
How long does it last?
3 to 6 months.
So you got to come back.
Yes. Yes.
Okay. So you make me look young for a little while, and then I got to come back at 3 to 6 months.
Well, there's a lot of myths out there that think, we need to keep up with it. There's something to say about, doing it a little bit early on, and I know that that's something that is taboo, and we, people didn't really think about this because it wasn't until, again, 15 years ago where we actually started using Botox for aesthetic reasons. And so we know more about it. And so that being said, it's kind of like crinkling a page in a book. The more that you prevent that crinkle from happening, you're not creating these creases. So if you start a little bit early on and prevent that from happening, you may not need as much in the future. Whereas if you're just starting out later on in life, you may need more.
Mm-hmm. So with Botox injections, do you suggest topical lotions or something as an adjunct along with the Botox, or not?
So the only thing I can recommend with Botox is if our patients would like to take some arnica beforehand. It's an herb that comes from sunflower.
No kidding.
And yeah, it'll just help with preventing.
Are you talking about topically, or you don't take that internally, do you? Arnica? Yeah,
arnica, it comes in a pill form, and they have in a topical.
Well, I'm thinking about the Western movies of John Wayne where they were having fist fights, and they were going to put tincture of arnica on the skin.
So I think if they'd like to take it orally, it's okay for Botox. I prefer the topical arnica for filler because that's more bleeding or perhaps risk of bruising on the lip.
How interesting. That is a very old product in the marketplace. Amazing. Wow.
Yeah, well, we love it. We really do.
All right. Better get back to the program here. Okay. All right. So if a person received Botox and earned points through the reward program, could they apply that to facial filler procedures?
Yes. And so any points that they get from any of their, let's say, Botox, yes, it can correlate. That's theirs to use. So if they decide to use those points at a next visit for filler, that's absolutely fine.
You know what? It's time for our final break. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Thanks for joining us. Let's get back to the last segment of the show. So I understand you have an upcoming special this month, a Botox Halloween special. Gosh, did I say that? Can you tell us about this?
Yes, it's called Botox. So
okay. I gotta change the spelling on my paper here then.
Yes. So we're very excited for the event. We'll be hosting it in October, and typically our Botox will go for $14 a unit, and we will be doing $11 a unit.
Wow.
The patient will also receive a goodie bag, a Boo goodie bag to go home with. It'll have some CeraVe products in it, La Roche-Posay products in it. Of course, I can't say it all because then I'll ruin the surprise, but our patients love the lines that we recommend. It's hypoallergenic and less reaction or allergic reaction. So there'll be moisturizers in there, maybe a serum, can't say. So
can I get a package without getting Botox?
Yes.
I'd love to see what you recommend. Okay.
Yeah. Stop on by.
Okay, I'll do that. All right. Okay.
So, we've covered a lot of areas, and I know you covered talked about wounds. We talked about breast cancer concerns. What about men? Do men get cosmetic surgery?
Yes, they do. Again, I think because the industry has been, taboo, and most even women will say, oh, this is a secret. Or they'll pay, I'm being realistic, pay with a different card, and I don't want anyone to know, or my husband to know, and things like that. And the same thing happens for men, I don't want, there's that stigma that I don't want somebody to know that I've gotten something done. And I think it's important to say it's okay to take care of yourself, or want to take care of yourself, male or female. And yes, men get Botox, and I think we've mentioned this before, we call it Brotox. And so with men, it's kind of like the idea of, more men are now getting more manicures or pedicures. And before we didn't see that, and so now we do. They know more about it. Or if an older male wants a facelift, that, within reason, they've gotten that as well, or upper blepharoplasties. And it's okay. I want to let the males know it's okay to want
Okay.
things.
All right. I got it.
So,
I got it. Okay. I understand.
okay. Yeah. So,
Are there any trending procedures among women we haven't talked about?
trending. I think one really interesting topic is for women, breast. I think I'm noticing more so, several years ago, in plastics, women wanted bigger breast. And what I'm finding now is the opposite, right? Kind of like how fads and fashions change. There's things in the industry that are changing. And so women are wanting smaller or more lifted, perkier, rather than make me bigger, or, put in an implant and make me a D or a C. I think
Is that procedure? And I know very almost no insurance covers that. Is it an expensive procedure?
Yeah. So, a lot of, I think we try to stay along the lines of what the industry is recommending you charge now. There's a surgeon fee, of course, and then there's a hospital fee if you have to go in a hospital. So you have to take that into consideration. Almost, this is nothing that's cosmetic, obviously, will be covered. However, if the patient has asymmetry, they were born with a breast that developed and then one that was underdeveloped, then that was something that would be along the lines of some, this is cosmetic, but it would be covered under insurance, because that is by no fault of their own that they were born with an underdeveloped versus a developed breast. So yes, some of these things can get covered depending on the situation.
Breast cancer, all those sort of issues are covered though, correct?
Correct. Breast cancer, yes, always.
Okay.
So we're running a little close on time. Would you like to take just a few minutes to comment on what you'd like our listeners today to know about Aultman Medical Group's plastic surgery unit, and how important it is, the services you provide, and how to get in touch with you or someone in your practice?
Yes, that's a great question. So I think what's important to know, and the takeaway message, is that not to be deterred by the stigmas that are out there in the media, that you know, it's very versatile. It's, we have this skewed perception that it's just what we see on TV, and we just do cosmetic. We do a lot of medical. So if you need us for something medical and it applies to you, whether it be a cosmetic lesion or a non-cosmetic lesion, skin cancer, please come see us. Some portion of it is acne related, so we can do acne. So younger females that are struggling with that, even adults, and even breast cancer. If you've lost a lot of weight, things like that, please come see us, and it's okay. Our doors are open. In fact, we welcome it because we love, both Dr. Lopez and I love what we do so much. And so, you know, I can actually give you our number in just a second when I find it. But I think
It's okay. I can edit. Take your time.
okay. You know, and not being afraid to come in, even if you want to just be evaluated. We have brought in patients and they think that they need a filler, and maybe that's not what they need. They may just need something lighter, maybe a microneedle or maybe a chemical peel, and that's okay, because that's why you do an evaluation. So, and it's exciting to talk about these things, even skincare lines that maybe we can recommend, just to stay refreshed or rejuvenated. So, you know, we think we need all these things, and sometimes less is more. So, okay, let me get that number for you. Okay, so our number to find us would be 330-499-2209. And you can either schedule with myself, Shannon, or you can schedule with Dr. Lopez, and our staff is wonderful and they'll know exactly who to put you into the schedule with, to be evaluated.
Thank you to our guest, Shannon Urena, Certified Physician Assistant, Aultman Medical Group, Plastic Surgery. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsors, Aultman Health System, Studio Arts and Glass, and January Appraisals and Liquidations. As always, we thank you, our listeners, for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday on News Talk 1480 WHBC. And Shannon, thank you very much. It was very interesting and fun. Okay.
Thank you.
Okay.
Good.
Enjoyed
Thank you
talking.
very much. Have a great day.
Thank you so much. You too. Take care.
Take care.